Hello everyone, this is Dr. Taposh and welcome to our channel Physiomax Organization. We are continuing our awareness program regarding the fake electrotherapy machine companies. Few of the videos we have already made, and from the last two series of these fake electrotherapy machine companies, we have got a huge response. We have got a huge queries all over India that which one will be the better. See, different states having a different companies, but I will tell you before you purchase any sort of electrotherapy machine for the physiotherapeutic treatment purpose, that which are the things you need to follow before purchasing that. So one by one in different series I'll be making you understand about different electrotherapy modalities. The last video which I made, that was in Bengali, but I will be making from now onwards all the series in English so that it reaches to maximum amount of people, because the queries which was coming, that's from all over India. Now first we need to understand about the machine, the most commonest machine, that's the ultrasound. People says that this machine sometimes it acts like a placebo. It does not have any therapeutic effects. For few of the condition, it's having a therapeutic effects. But do you really think that you know the proper way of purchasing the ultrasound machine? Do you really know, you have the knowledge of before you purchase the ultrasound machine, which of the things you need to ask from the person who is selling the machine? Do you know what's exactly inside of that transducer head? So there are a lot of queries. So first, one by one, we will understand the theoretical portion. I will make you understand from this video, and this practical portion of understanding about the proper ultrasound machine I'll be showing you in the next video. Before that, I need to tell you that the whole description, the whole detailed description of this video is there in our YouTube channel. That's the again Bornagar Physiomax Organization. You can type in that and you can go and see the whole episodes of different type of electrotherapy machines and also different educational series of the physiotherapeutic conditions. So the first, before you go to purchase a ultrasound machine, the queries which is to come: do you know what is BNR? Do you know what the SATP and SATA intensity is? Do you know what is fountain test? Do you know that ultrasound transducer does not make any bubbles, and if it makes bubbles, it's a fake machine, and the crystal which is there inside is a fake crystal? What exactly these are? Except of that, there are a lot of other things also you need to see. Does the machine is having a 1 or the 3 megahertz or both? Does the machine is provides a small transducer head or not? So there are a lot of things is there the time you will purchase a ultrasound machine. I will make you understand what's about that. Wait and see. In continuation of our understanding regarding the proper electrotherapy machine and how to detect the fake electrotherapy machines, we are doing the series as a 5th episode of understanding the electrotherapy machine, and this is the 2nd episode of ultrasound, that how you will understand the ultrasound is working properly, or which is the best way to understand that the ultrasound machine which one you have purchased that is correct or not. In our last video, I have told that about few of the important terminologies, that is the BNR, that is the SATP and SATA. Today in this video, we will understand that what is these three terminology is and how to understand with these three terminology that the ultrasound is working in a proper way or not. Normally, whenever we used to purchase any sort of ultrasound, what we used to do? We used to take the transducer head. We should take the transducer head and consider this is the effective radiation area, ERA. Above that, we used to just pour a drop of water and we used to see that drop of water is making bubble. Sometimes it's getting vaporized or sometimes it's making like the water to be a fountain. Then which one is right? That you will understand from this. Does the water which is poured above the transducer needed to be vaporized, or it needs to make such a way so that it looks like a fountain? So to understand that, to understand the fountain test, just pouring the water above the transducer does not mean the ultrasound is proper, or just pouring the water about the ultrasound transducer head, and if it is vaporized does not mean the ultrasound working in a proper way. So to understand that, we need to understand the important three terminology. Amongst that, the first one is the BNR. The second one is the SATP, and the third one is the SATA. What is this three? BNR denotes of beam non-uniformity ratio. So we will understand now what is this BNR is. So BNR denotes of beam non-uniformity ratio. So it comes as a part of a ratio. Then what is this SATP is? Spatial average temporal peak. And what is this SATA is? SATA denotes of spatial average temporal average. Now you are thinking that was that it's difficult or not. So first you need to understand this, how these three things are coming when we are doing the ultrasound machine as a checking procedures. Consider this is the transducer head, and we are deciding the intensity. So therapist who is having this knob with their hand, and this intensity it can be 0.2 watt per centimeter square. It might go to 2.8 watt per centimeter square. It can be 1.2 watt per centimeter square, or it can be 2 watt per centimeter square. Remember, therapist can decide this. So which one can therapist do? Therapist can decide the intensity. Remember, whatever the intensity we are deciding as a therapist, we are deciding the spatial average temporal peak intensity, SATP. So from the midpoint of the ultrasound head, that consider I have decided 1.2 watt per centimeter square, the midpoint of the ultrasound head, it will have a greatest intensity. And from the surrounding, it will be the 3/2 of this one. So the ratio will be, if this is considered as a 3, this will be 1. So 1.2 watt per centimeter square, if it is considered as a 3, then the watt will be 0.4. And this 0.4 is the SATA intensity. So SATA used to SATP 0.4 used to 1.2 watt per centimeter square. So this is considered as a 1:3. And this 1:3 ratio, it's only the beam which is non-uniform. Remember, this wordings is very important. Non-uniform. That means throughout the ultrasound head, whatever the intensity it will come, it will not come as a uniform pattern. That's the non-uniformity. And that is very important. And just because of that, it looks like this fountain, and that's why it is called as a fountain test. So from the next time onwards, whenever we will go to purchase any sort of ultrasound, whenever any company come to you to detect that to sell their ultrasound machine, just don't just keep the water above the transducer head. See that the transducer head is giving this proper fountain or not. Then only you will understand that ultrasound is proper. So any queries, don't forget to comment in this channel comment box, and the detailed video, of course not in the Facebook video, everything in the YouTube. Our YouTube channel name is Barnagar Physio Max Organization. I request everyone to come and subscribe the channel to learn each and everything regarding the medical and the physiotherapeutic education. Thanks once again.